The topics discussed and the information provided on this program is for general information. The hosts of this show are not medical professionals and are expressing their personal views and stories related to their individual lives. Their views are not intended to be used or taken as medical information. If you or a family member have suffered a traumatic brain injury, you should seek help from a practicing licensed physician.
My brain. My brain.
We hope to help you. We want you to know that there's some life after the hurt. Hey, welcome to Brain Mechanics. And look, I'm in the big chair, and there's a really big reason for it today. Today we have some exciting demonstration of techniques and products that are out there. We have as our special guest Kevin Butterfield, who's with Brain Forest, and he's going to show us today some machinery which helps reset the brain. He's going to explain it. That's why I'm going to turn it over to him. But Matt's in the chair over there. And the reason he's there is because he's going to wind up getting this Brain Forest treatment today. We're excited. And remember, we want you to know that there's help and hope after the hurt. We're not nutritionists, nor doctors, nor therapists, but we've been there, done that, and experienced what you've gone through and are going through. We want you to know that there's hope after the hurt. We want to take it over to Kevin and Matt for his treatment here, and Kevin will explain where this technology came from and how exciting it is. It's non-pharmaceutical. Kevin Butterfield, Brain Forest. Thank you.
Hey, glad to be here. Go first clap. So what we do here at the Brain Forest Center is we actually do techniques that have been around since the 60s. You know, NASA uses it, and a lot of top tier athletes use this as well. It's done with EEG neurofeedback. We do deep brain neurofeedback, which is we put a cap, which we're going to put on Matt here in a second, that has sensors on it. And when the brain has a certain frequency, like you've seen a heart rate monitor go up and down like that. So if the brain waves do the same thing, but if this is like a normal range, and every time the brain waves go through here that we measure, it'll make a beeping sound, then stop, and then come back down and make another beeping sound and stop.
Okay.
And if we hear the noise, it's just noise. All right. If somebody's connected to it and they hear the noise, their brain figures out that it's a pattern, and it wants to stay there. Okay. You're training the brain to get back in its optimum performance frequencies. So that's what we do. We also do eye tracking metrics because we see a lot of concussions, and we do a lot of peak performance training. So you want to get the most metrics you can of the brain to, there's normative databases all over the place for this.
Okay.
So we have that to compare it to. And we can take anybody's brain and make their brain better just with this therapeutic option.
So this is something that would be helpful to traumatic brain injuries, stroke victims, people who've had to have surgeries.
It does good for addictions as well. I mean, because there's an electronic gate of addiction in there that you can see it. With technology today, you can actually pinpoint where the problem is. We've seen a lot of addicts come through our way. I mean, our thing was, let's see as many young brains as we can to get them better so they don't have a problem when they get older.
So maybe autism, ADD, HD?
Spectrum disorders, yes. Learning disabilities, yes, absolutely.
Holy smokes, I'm really excited here now. I know Matt going way back, so I'm not sure what we'll see on this pattern here, but I think that this is really exciting stuff. And as you may know, explained earlier, that my wife was a victim of a crime, had traumatic brain injury, and I knew nothing about it. For those of you that are out there, you just don't know anything, and the next thing you know is you know that you know nothing, and you're relying on doctors or whoever will talk to you, or you're on the net trying to find out what the hell. And honestly, at the time when this happened for Matt and my wife has been a number of years ago, and this type of help was not generally known that I'm aware of, right, Kevin? I mean,
correct.
You've kind of brought something old into the.
I
new-
mean, it is used, but I guess a lot of psychiatrists or other doctors have it in their closet to pull it out when they need to.
Okay.
This is the #1 thing they use in Europe first. If you have any kind of mental health problem, they try this first. If this doesn't work, then they talk about it. If that doesn't work, then they medicate it. And America is usually backwards. Let's medicate it first and cloud the water up,
Yeah.
so you can't figure out what's going on. So.
Well, and you use the words mental health, but that doesn't just mean, we think of that as someone who's maybe disturbed or something, but mental health to you is a very broad range. It's not just somebody who's acting crazy, but someone who's challenged maybe.
Yeah, it's not somebody, we look at, it's not somebody that's in a straitjacket, which is usually the way you think of a mental health problem, but I mean, if you get a concussion, they don't go away, they make you different. So it could be that, it could be the PTSD, the electronic storms of the brain. Again, we have a very accurate model to look at the whole brain and to see what it's doing. And where there's too much electrical activity, maybe you can't sleep, maybe you're stuck in fight or flight mode.
Yeah.
We can unstick that with this.
Oh, man.
So you don't have to have any.
But as a human being, hi. I got to interrupt. As a human being, aren't you always in a fight or flight mode?
No, only when you need to be.
Yeah, that's what I mean.
But you can go from a state of I'm very mellow and I'm processing my surroundings to if somebody jumps in the window and you want to karate chop them, you jump right into a state of fight or flight. Yeah. You're not going to be, we see a lot on the people that we see, they're stuck in fight or flight and rest and relax at the same time.
Well, if you get PTSD, some of that's inner training. You're trained to stop all those actions, all those calls.
Military type people.
Right.
So it would be,
Right,
I think, let me try and understand here. As opposed to a medicine, which might just level someone out, we've experienced that where particular medicines just like, there you are. I mean, that's the whole day.
And there's a reason. There's a reason for that.
But this is actually retrains the mind and brain so that you can act more normally.
Yes. Okay. Let's say we look at 6,800. We'll see it on the map when I plug him in.
Okay. Cool.
That we look at 6,800 boxes in your brain, right? And each one of those boxes is the 9 distinct brainwave frequencies.
Okay.
So if his problem or anyone else's problem is 600 of those boxes are either overactive or underactive, we're going to focus just on those.
Oh, wow.
Leave the rest of the brain alone.
Kind of dial in.
Yeah, you can pinpoint. I'll show you how close we can get to it. But if there's a lot of areas in the brain that are okay, but you take a medicine, it's either going to be an up or a down or increase or lower your brainwave frequencies collectively.
Right.
So if that medicine's got to go through the area which is normal, that's where your side effects are going to pop in because they don't need anything done with them.
Became one of my personal opinions, Indiana, and everywhere in the country. I'm coming out of a 54-day coma. I'm brain dead. And all they're doing is giving me oxycodones. They're giving me that I hadn't even heard of different types before.
Yeah.
Percocets, different things to keep me down.
Yeah.
Like I had been.
Yeah.
And my dad said you're talking sometimes because we toss those drugs away. Keeps people from coming to your house, because everybody's looking for that. So we got rid of them, Dad and I, just an old man and me.
Yeah.
Yep.
And hell, I improved 100% almost in a week.
Well, I think you made an
I
important.
woke up. I wasn't a zombie no more.
You can make anything a zombie if you medicate it enough. I mean,
Right.
Dr. Butterfield, it is a question then too, because people we have a serious problem with the addictions and the like out there to various things. And is this, I'm being hopeful here, it's nothing you've told me previous, is this something that can help with those type of addictions that kind of get you to help back away? I mean, it's not an answer necessarily, but can the brain be reset?
Yes. I mean, that's that electronic gate of addiction again that I was talking about where you can see in there.
Okay.
That's right around the center of, stress, anxiety, and PTSD. If you reset the timing in that area, it also closes the gate. We had a lady who was, and again, that's why we want to get everyone young.
Yeah.
Because you start off on a focus pill, then you can't eat, then they give you a pill to make you eat, then you can't sleep, then they give you a pill to make you sleep. So that just keeps adding up. Then you get off your parents' policy, whatever, then you got to go throw something through that gate to feel normal again. And that's usually where the illicit drugs come, then problems come, then jail comes. It's just a vicious cycle that we want to break.
Right.
We had a very smart lady who was a nurse who was, she was prescribed opioids for her lupus. And the doctor said, okay, let's come off these opioids because it's addictive.
Yeah.
Once they did that, her brain felt funny, so she had to throw something through that gate to feel normal again. So she was up to those computer duster spray cans. She was inhaling 40 cans a day. That's a lot. The computer duster spray.
The stuff you use to clean your
She
keyboard
was huffing it, yeah. Okay, now first of all, I said, well, first of all, how come your brain's not mush and where do you get all these cans at? She had a route she'd go on every day to get different cans, get a stack of cans.
Oh, so as to not be suspicious.
Yeah, but she went through our program. We have a Brain Force Step Down program, which is for addictions, which is, you see them twice a day for like a month, including Saturday and Sunday.
Yeah.
To shut that gate. And she's been over a year now sober, clean. And that's a hard one to get rid of.
Well, that's to the brain force has grown. You've grown. I know we got a lot to go through.
Yeah, I mean,
we just grown so fast, and
it has. I mean,
doctors and the different people and the programs that you now have that
Yeah.
certainly wasn't there. I test drove most of this stuff.
Yeah, he did. Yeah.
He's my friend.
No, we've done. Again, our thing was let's get the kids when they're young.
Yeah.
When they have a concussion, let's get those guys too, so they don't have problems down the road, right? But we have, when we started seeing addicts, and they're clean now, so they started referring more addicts, and then so we're doing. You know, current addiction facilities have a 7% success rate. This is a lot higher, right? Because we actually address, you know, where the problem's coming from. But
Like
we had a community in northern Indiana that the foundation came together and they said, here's a lot of money. Come up and help us with our drug problems here.
Wow. Well,
So,
I think
Parnersville, there's people that should be doing this around here that's been identified.
Well, I think that you just made the point. Now, it won't take away Matt's sarcasm, will it?
I'll try. I don't think so.
Good luck with that.
Oh, man.
Might have to shut down a power grid to get to him.
Leave that off me.
We're joking, but we're going to get Matt suited up here with
let me put this on your head.
Really pretty looking skull cap, and we'll get going on this. Okay.
All right, let me move this here real quick.
While they're hooking him up, and of course we can show that, but all this is done through the computer with a particular program, correct?
Correct.
And it doesn't hurt.
All right, it will. I'll hurt you.
You got to glue this stuff on this time?
Yeah.
I have not used this apparatus
Here, come
before. I had
Scoot up.
a cap before used.
All right, I'm going to put this on your forehead, and you're going to hold it there, okay? Ready? Well, let me see. Hold on a minute. All right, there you go.
Well, I got a big head. We know it's hard.
Now we'll pull this down, and we'll put a chin strap on you. This is just a real quickie.
And he's also checking me out because, yes, I was in an
Tell him
accident.
what. Matt can't stay out of windshields. He loves to crash into things.
Catch that windshield.
And I'm not talking about staring through them. Matt, unfortunately, he and his daughter were in an accident in Indianapolis, and Matt has officially sold more windshield for safety auto glass than a lot of rocks and bricks have. He's done it with his head. So I just want you to know that. So he's hooked up now. Looking good. Looking
Keep
good.
talking. I was going to set
My
this
head
up.
saw the inside of the windshield turn outside.
Yeah.
My daughter saw the back of me when she's pregnant, and we're very fortunate that we
okay.
both came out great, but she hit me instead of the windshield or the dashboard. Yes, I'm alive still.
We're seeing some patterns here on the screen, or a little bit coming up. So I don't know whether you'll be able to follow this, or whether we can zoom in on it or not. I'm not sure how that display will work. Oh, it looked pretty good. And so what we're going to do is have Kevin explain this. Are we seeing feedback from Mr. Matt at this point?
Yeah, okay. This is his brain map. If you went to a hospital, you're going to get kind of the same thing.
Okay.
Hold on a second.
And of course, there's some instructions he's working on there, as well as the reading this input. Now, what we're seeing here, every brain has activity going on. Basically, what the hood or the device on his head is doing is currently sensing what's going on inside his brain, correct?
Correct. So if you went to a hospital and got a brain map, this is what they're going to do. They're going to hook you up to some kind of gadget like this,
Okay.
system like this. But what they're going to look at is these are all the sensors on his
Zoom
cap.
in on that again.
This is 64 spots.
Yeah, these are the sensor locations on his brain,
Okay.
and each one of those is a raw brainwave signal from his brain.
Okay.
So they just look for anomalies there, like seizure spikes or problems like that.
Okay.
Looks like I'm playing some pretty heavy metal
Yeah,
right
yeah,
there.
you are. So what we do is we break down each one of those lines into 9 frequencies, and we put them in a box.
Okay.
Okay. This is actually his brain right now here, in real time compared to a normal brain.
Okay, we get to see a normal
Hold on a
brain.
second.
Now this is an actual. This is Matt's brain we're looking at here, right?
Yeah, hold on a second. Yeah.
Now these patterns of light indicate what's firing in his brain at the time.
Yeah, so this is the side of his head, his nose is right there, his eye, his ear. All those boxes should be green. That's the normal color you want. All right, so we can look at all over the brain and see where the problem is. And it's going to give us, when we get done, it's going to have, we're not going to do it now, obviously, but it's going to have like a 180-page report,
Well, wow.
so we can look at it. We can see not only the outside of his brain, how it's working, but we can also look at the inside of his brain and see how that's doing,
Oh, cool.
which is there.
Now, in
So the
this
blue
partic-
spot, where's the hole at?
So if it's well, I mean, here's the gauge right here, but if it is yellow, orange, or red, or white, it means there's too much electrical activity in that area compared to a normal brain.
Okay.
And the other opposite direction is light blue or dark blue. That means the brain is not firing like it should, or it's
Now,
in
I think
sleep
since
mode.
we've got this up on the screen, that people can see that you've basically, in essence, zoomed into the center part of his brain, correct?
Correct.
So we're seeing the colors there.
Yes. So this is his brain right now as it's working.
Okay.
Would
Okay.
the blue be where the damage
Yeah.
has been?
Oh, it can be either color. We gotta look at the reports and see what they all
Yeah.
say. But you
I
get
would
a
look blue.
complete look at the brain. Usually at the frontal lobes, you got behavior problems. You got that's your personality. That's where your stress, anxiety,
Can
and
you
stuff.
show where the frontal lobes are at?
Yeah, they're right here in the front.
Well, yeah, just so because people are learning from our show, and honestly,
Right here,
yeah.
the front here.
And that's what
So
I
basically,
that's
just
the
right
part I
behind
just
the
hit.
eyes.
Yeah, there's the nose here. You can see that, but right in the front.
Okay. Cool.
But again, this detail is very specific. Now, let's say that let's say the report comes back and says that he's got a problem in a certain area, because we can zoom in. We can take it like the frontal lobes would be like Indiana,
Yeah.
and then a different segment that we're looking at, like a certain gyrus in your brain, would be like Richmond.
Okay.
And then the Broadman areas are pinpoint specific. That would be like the street you live on.
Okay.
Right? So we can zero into that. So let's say Matt here, if this was a training screen, let's say Matt's problem is in Broadman area 33, which is that.
Okay. So you can.
That's the only areas we're going to work on to fix those areas. But you
Yeah.
can see that if that's the problem,
Right.
and if you medicate all this, that
What's-
doesn't need anything, I mean, you're going to have some side effects with that.
Sure.
So that's how pinpoint specific we can get with our training.
So that's, I mean, we know this part of my frontal lobe was the big hole,
Yeah.
and then twice through the middle.
Yep.
Is that the blue showing up on there where there's?
Yeah.
Because you're more towards the center of that squares around the, whatever that's called.
What Matt's referring to is the specific injuries that he had as a result of his motorcycle type wreck a number of years ago, the first big injury, if you will. And that's what he's trying to allude to here. Those of you that are not familiar, Matt was injured in a motorcycle wreck a number of years ago, very, very grievously hurt, and was restored back to health through innovative treatments. An enormous amount of time, money, and effort went into bringing Matt back. But also, I want to say this, Matt has a determined will. And I think what this program that Dr. Butterfield is explaining here with the Brain Forest is that a determined will for you, and this is what I allude to when I kind of joke around at the beginning of the show. You have to have hope. There's help and hope after the injury. And these are the kind of guys that can get it done. Matt encourages you, and Kevin is in a position to actually get it done.
Yes. And they say that when you do this kind of training, again, this would be, he would have 5 sensors on his head, not this. This is just to get a brain map, to get a baseline.
Okay.
But when you train them, 20 to 40 sessions is what you need for your brain to stay there.
Okay.
It learned, it stays there, it likes to, And we've had profound, excuse me, results after like the first session. We had one guy who was a military PTSD guy.
Yes, a lot
And
of that.
it's a guy that couldn't sleep more than an hour a night for 9 years. He's had 30 jobs, just as many relationships, tried to kill himself twice. And the VA told him that this is the way you're going to be. Deal with it. That's all you got. Now, we're not anti anything. We're just pro of what works. You know what I mean? If the medicine's not working, that's not the right route for them to go. But so he came in. I said, "Here's your brain map. Look at it." He wouldn't look at it. I said, "Why aren't you going to look at it?" And he said, "Well, because you're going to tell me the same thing everyone else did. This is the way it is. Deal with it." I said, "No, I'm not. I'm just going to tell you what I found." So we started training him, and after his first visit, he looked totally different.
Yeah.
And he got up and he said, "This is how I used to feel." And I said, "Well, that's maybe placebo because we just did it one time. You have a 9-year head start on me." So then after the 4th session, now he sleeps 6 to 8 hours a night, and he's not jumpy. He sleeps good, and he's still that way today. Because we just reset the timing in his brain where there's too much electrical activity going on.
So
They say it's not shock therapy.
It's not. No, it's not.
It's audible therapy, I guess.
Yeah,
non-invasive as well, is it not?
Yeah, it's not. I mean, this is all, you just got a little bit of wet on your head there, but I mean, it's not shock therapy at all.
No,
The sensors on your head are just monitoring what your brain is doing.
A lot of the therapy I know is the sound therapy, and that's kind of like Martian rock and roll, if you will.
Yeah.
It's just, I guess there's not really a beat to it, or
The way it sounds like that, it does have different sounds to it, and people ask me, why can't you just listen to a tape or something like that? Well, you can. I mean, that'll relax you, but not specifically changing anything in your brain to like those little 4 boxes that we just saw. It can't do that.
Well, after all of what Matt's been through, he probably is one of the few people that know Martian rock and roll.
Yeah, he does.
But, I'm unaware of that myself. But what we want to do here is we want to get the word out. We're going to have an additional show after this, the same,
You wanna do the
same
eye
product
stuff?
and that sort of stuff. We're going to do some exciting stuff. And I got to sit in the big chair for once, but for a very good reason. Thanks for listening to us on Brain Mechanics. I appreciate it. And we'll be back. Got some excitement here. What we're looking to do is an additional test that Dr. Butterfield is doing with Matt. He is not enjoying a virtual reality movie.
Open.
He is doing, and you'll see an odd headset on Matt here, where we're actually looking at his eyes and eye movement. Dr. Butterfield, what are we doing here exactly?
Well, what we do at the Brain Force too, because we see a lot of concussions, and we want to get all the metrics we can of the brain.
Okay.
So we'll get a brain map of it, and we'll look at the eyes and see what they do. If a dot pops up in the screen, you got to follow it, and you got to track it. There's his eyes right there.
Oh, wow.
We can see him. I can do one test, and we'll see what his eyes do.
Yeah.
All right, you ready?
Mm-hmm.
Okay.
Pretty neat. Just watch his eyes when he does it.
We zoom in on this.
All right, hold on. Do you see anything?
they're getting closer, I guess. I don't know. I see 2.
Hold on a second.
You may not be able to see in the monitor there, but there's appear to be some brief flashes of light and that sort of thing, which are triggering to his eyes.
Yeah, hold on, I'm going to try to get his eyes to do something.
Yeah.
All right, let's see what this does. You got to follow the dots.
The red one?
No.
And so, what's happening here is that the
4 in the middle?
like the old eyes are the window to the soul expression that was out there. The eyes also, do they not, Doctor, reveal a kind of a direct connect to the brain and what's going on in there?
Yeah, absolutely. I mean, if you're giving your brain some tasks to do,
Okay.
and if you see a dot that pops up on the screen, you follow the dot with your eyes.
Okay.
But how long does it take you, to look at the dot and know there's a dot there?
Yeah.
And then the eyeballs converge on it. Follow that dot in there. The eyeballs converge on it and the pupils constrict. So we
Okay.
can see any kind of delay in one side of the eyeball to the other one, which tells us the pathway from the back of the head to the front of the head, the visual pathways there.
Might be some issue going on. Okay.
Yeah.
Okay.
You're telling me I'm slow?
Oh, hold on, yeah.
Well, you know, Matt just made a joke about being slow, but actually, I think what he is learning is the differential in the way that the brain operates side to side, so that you can better locate what needs treatment. Correct?
Correct.
Oh wow.
So we can focus or we can concentrate our protocols on that.
Maybe I'm deserving of the big chair here.
Well,
I don't
maybe you
know.
are.
Just saying.
You should adopt.
So Matt's eyes are following some patterns or dots that are going on in there. It's pretty neat. And
Yeah.
you
So
can-
then once we get a baseline of the brain and get a baseline of the eye tracking, we know where to train them back to if they should get a concussion.
Cool. And this could be done. You don't need a previous scan or whatever this would be called to help someone, or you can help them after the.
Oh, we can
injury.
yeah, we can help them at any time. I mean,
Okay, all right.
especially yeah.
I'm sure it would have been a good adjustment from having my injuries and then getting a concussion a month ago.
Well, you're here now, and he's.
No, I mean the adjustments.
Are we good?
Well, we're pretty excited here, guys. As you can tell, this is a treatment and it's completely non-invasive, correct?
Correct.
So there's nothing, there's no medicine, no drug, no knives, no punctures, nothing.
Ouch.
It's just a really, really neat thing. We're gonna leave today with Matt fully ensconced in he doesn't see at all. He's seeing dots or something going on there. But we're excited about this. We're going to do another episode on this, and like I said, very, very, very excited about maybe a very, very promising treatment. Correct?
Correct.
All right, Brain Forest. Check it out.
The topics discussed and the information provided on this program is for general information. The hosts of this show are not medical professionals and are expressing their personal views and stories related to their individual lives. Their views are not intended to be used or taken as medical information. If you or a family member have suffered a traumatic brain injury, you should seek help from a practicing licensed physician.